Good morning. We have this really terrific young guy, and he and I are going to talk very briefly about buccal fat removal and a chin implant. You came in, maybe a month ago or something like that?
A month or two ago.
And you had some goals and objectives that you wanted to talk to us about. Can you tell us sort of when you started to think about this at home, what were your goals?
So I never really liked the fullness of my cheeks or on my face, and I noticed that my chin was a little bit recessed, so I wanted to do a consult with you to see what we could do to rectify that. And you mentioned the buccal fat removal and the chin implant. It's
something we've done for a good long time. I think it's slowly gaining in popularity. Folks, when they want to get a little bit more definition here, some people talk about it sort of Nefertiti cheeks. There are these various terms out on the internet. You want to do it in a way that's moderate. Like so many things in plastic surgery, if you go to an extreme and you take all the fat out, you can get, maybe too much. And then with regard to the chin implant, we do a ton of chin implants. It's sometimes we do it with a rhinoplasty, sometimes we don't. But yeah, I think it's terrific. And when you started to research, we have many good plastic surgeons here in town, this region. What led you to us?
I noticed that Dr. Leong, you had a highly rated, you were highly experienced, and you really had personalized recommendations for your patients.
There you go. In the land of the internet now, people hear in various ways, they make their choices in various ways. And so we always think doing research on the internet, when you come in for a consult, there's what you experience on the internet, but I think it's good to correlate that with what your experience is face to face with a doctor. This is exactly 7 days out from the procedure. What did we do? We did a chin implant, and we did bilateral buccal fat removal. You were just telling us there was a little bit of discomfort the first couple of days, especially around the chin implant, so you took a couple of Percocet. How was that? How are you feeling now?
There was a bit of pain in my chin. That was to be expected given the surgery, but there was a bit of pain and swelling, but that got better after a few days, and I immediately saw the results. It looked really nice.
So you see the chin implant, you see that relatively quickly, but the buccal fat, as you can imagine, you've done a little procedure in there, and so there's some swelling, and we also did the chin implant. You can see he looks pretty good, but there is a little bit, if you look very closely, there's a little bit of shadow from some of the resolving bruising. And so that's all just a totally normal part of the process. We have this very nice gentleman who is now about 6 months after his 2 procedures, really. He had a buccal fat removal, a transoral buccal fat removal, so there's absolutely no incisions outside. The incisions are actually, inside the mouth. That was about 6 months ago. We just looked at the pictures, about a few minutes ago. For the first time, really, we finally looked at the pictures before and after. What were your thoughts when you saw the pictures?
I was absolutely amazed. I came in 6 months ago because my face was really round, and then Dr. Leong here recommended the buccal fat removal and then the support in the masseter muscles, and I looked at the pictures, and I'm amazed how much slimmer my face got.
And we were actually talking right after we looked at the pictures, because we chit-chatted for a few minutes before we looked at the pictures. And what I always love is that in talking to you, you look stone cold normal. It's not as though there's any sort of, hey, listen, this guy has clearly been operated on or something like that. Until you and I looked at the pictures, and then you put them side to side, and you can look at the before and after pictures. It's a very natural, subtle looking change, but it has a very significant impact on sort of the overall sort of impression that the whole face makes. Recovery was okay?
Recovery was great. A bit of swelling for 1 or 2 weeks, but that was expected from a surgery. And then after that, I just started noticing my face getting slimmer and slimmer. I'm very happy with the results. It looks very natural.
You're happy, I'm happy, and you have a totally natural appearing, successful result, and that's what we like to see in this practice. So thanks so much.